Low back pain is very common. It is estimated that 60 to 80% of the general population will experience an episode of low back pain in his or her lifetime. A variety of lifestyle factors can have a cumulative effect on the different sections of the spine. These factors can range from your profession through to the mattress you sleep on every night. Unnecessary amounts of stress can be placed on your back by sitting still for long periods of time or performing heavy lifts in the gym. Low back pain is one of the top reasons why an individual may decide to come and visit an osteopath or physiotherapist. The lumbar spine, or low back, is made up of 5 spinal bones known as the vertebrae. They're referred to as L1 to L5. The low back supports much of the weight of the upper body and has a natural inward curve known as lordosis. The vertebrae in the low back are supported by a variety of different soft tissue structures, including muscles, ligaments, intervertebral discs, and nerves. The muscles in the low back aid in supporting the spine during twisting and bending motions, as well as flexing and rotating the hip, enabling you to walk. The ligaments in the spine create strong supporting structures around the vertebrae and vertebral joints to stabilize the spine during movements. The intervertebral discs in the low back provide a cushioning and act as shock absorbers for the low back. The nerves in the low back innervate the muscles and supply sensation to the pelvis, thigh, leg, and feet. Most low back pain has an acute onset and can last anywhere from a couple of days through to a few weeks. Back pain that has lasted for around 6 weeks to 3 months is classed as subacute, and back pain that has lasted for more than 3 months is classed as chronic back pain. Most acute low back pain manifests due to an injury to the muscles, ligaments, discs, or joints in the low back. What are the common types of low back pain? There are many types of ways to categorize low back pain, as mentioned above. The time period of the back pain is one way. Other ways of categorizing low back pain is by the type of pain an individual is experiencing. Mechanical pain. This is the most common type of low back pain. Mechanical pain is a pain that arises primarily as a result from injury to the muscles, ligaments, joints, or bones within the lumbar spine. The presentation of this type of pain tends to be localized to the low back, buttocks, and occasionally to the thighs. It is usually made worse by certain movements of the spine, including flexing forwards, twisting, going from sitting to standing, walking, and laying down. Radicular pain. This type of pain refers to pain caused by irritation of the nerve roots as they exit the lumbar vertebrae. This may be because the nerves have become trapped, impinged, or inflamed. Radicular pain usually follows a certain pattern. This is known as dermatome. Your physical therapist will be able to understand which nerve is irritated based on the location of the pain down the lower extremity. Radicular pain usually feels very sharp and can create a burning sensation as well as pins and needles. It can also be associated with muscle weakness and a feeling of numbness in the buttock, thighs, legs, or feet. This is normally only felt on one side of the body. However, there are some conditions that can cause you to have these types of symptoms down both sides of the body. Other categories for low back pain are pain from inflammatory conditions, such as ankylosing spondylitis and rheumatoid arthritis. With these types of conditions, pain is usually worst when at rest and is generally relieved by activity. It is a chronic type pain that is accompanied with morning stiffness lasting for more than 1 hour. It is normally relieved by non-steroidal anti-inflammatory medications such as ibuprofen or naproxen. The other type is referred pain. This is when the pain originates from another part of the body. Common examples of referred pain in the low back are kidney stones, ulcerative colitis, cystitis or bladder infections, fibroids, and pelvic inflammatory disease. Common causes of low back pain. There are many different causes for low back pain. The most common causes are mechanical in nature. This means that there's a disruption to the normal functioning of the anatomical components of the low back. I will now present a list that includes some of the most common mechanical causes of low back pain, as well as some of the non-mechanical causes. Bones, muscles, and joints. Muscle strain, When a muscle is stretched beyond its normal limits, this can sometimes cause the muscle to tear, damaging the muscle. A muscle strain is usually a result of overuse, fatigue, or improper use of the muscle. It can happen suddenly, or it can develop slowly over time. Ligament sprains. Ligaments are strong supportive tissues that are located around joints. They act as a supportive structure around a joint that aid in improving stability of the joint. A sprain occurs when the ligament is overstretched. Sometimes tearing can occur. This is known as a ligament rupture. Facet joint dysfunction. The spinal column is made up of 33 spinal vertebrae that are connected together by facet joints. The joints have cartilage between the bones and are supported by an abundance of ligaments, including a capsular ligament. Within the capsular ligament, there is fluid known as synovial fluid, which aids in the smooth moving of the joint. The capsule, ligaments, and joints are highly innervated. Through injury, trauma, poor posture, and many other reasons, these joints can be affected and cause pain, on their own or in conjunction with the other intervertebral discs. Spondylolisthesis. This is where one of the vertebrae in the low back moves out of its usual normal position, usually slipping forwards. This causes instability within the spine. If the bone slips too much, it may compress onto the surrounding nerves, causing pain and neurological symptoms down the leg. Sacroiliac joint dysfunction. The sacroiliac joint is located at the base of the spine, where the spine meets each side of the pelvis. It is a very strong joint that absorbs a lot of force created from the upper and lower body. The SIJ doesn't have much range of motion and can become painful if there's too much motion or too little motion. It can also become painful if it becomes inflamed. This is known as sacroiliitis. Changes associated with age. Spondylosis is another term to describe osteoarthritis of the spine. It is the age-related changes that occur to the spinal column, including the discs and facet joint. As these changes occur, they can cause pain, inflammation, and instability within the joint. In some cases, it can cause a narrowing of the spinal canal. This is called stenosis. Degenerative disc disease. This is an age-related condition in which one or more of the intervertebral discs within the spinal column lose their ability to act as a cushioning for the spine. As a consequence, they become weaker and develop tears. In some cases, it can also cause the spinal canal to narrow. This again is referred to as stenosis. Osteoporosis. This is a condition in which there is a weakening of the bones due to a reduction in bone density. There is greater prevalence in the elderly, but can also come as a result of some endocrine and metabolic diseases. Due to the reduction in bone density, compression fractures are common, which can sometimes cause pain. However, pain is more likely to be caused due to there being compression onto the neurological structures as a result of the compression fracture. Nerve and spinal cord problems. Lumbar herniated disc. Intervertebral discs act as a cushion, aiding in holding the spinal vertebrae together. The discs help prevent the vertebrae from rubbing together and consist of a gel-filled inner layer surrounded by a hard fibrous outer layer. Sometimes a person can injure or strain their discs, causing part of the gel-filled nucleus to herniate out of the fibrous outer casing. This is known as a herniated disc, prolapse disc, or slip disc. When the disc herniation occurs in the low back, it may compress onto the sciatic nerve, causing symptoms into the buttock, thigh, leg, and/or foot. Spinal stenosis. This is a condition in which there's a narrowing of the spinal canal. There are many different causes of spinal stenosis, such as injury, trauma, and degenerative changes. Less common causes of low back pain. Infection. Spinal infection is very rare, but can cause severe pain and be life-threatening if left untreated. Also known as osteomyelitis, it can be caused by bacteria in the bloodstream, infectious disease that spreads to the bone, infection from recent surgery, or injection in or around the bone. Tumours. Tumours in the spine are not very common. However, if they do appear, they usually start elsewhere in the body and metastasize to the spine. The most common tumours that metastasize to the spine start from cancers in the prostate, kidney, lung, breast, and thyroid. Autoimmune diseases. Back pain is a common symptom in individuals suffering from autoimmune diseases such as ankylosing spondylitis, rheumatoid arthritis, lupus, and Crohn's disease. Diagnosis of low back pain. In order for low back pain to be diagnosed, a visit to your GP is not always necessary. Some causes of low back pain can be diagnosed by physical therapists. Examples of physical therapists include osteopaths and physiotherapists. In order to ascertain the cause of low back pain, a precise case history will be taken. Information regarding your current and previous symptoms will be required, along and throughout the physical examination. This will allow the practitioner to make a more informative and accurate diagnosis. Practitioners may ask the following questions while taking a case history. When was the onset of any pain or symptoms? How long does the pain persist for? What is the nature of this pain? When the pain started to affect you and what you were doing? Has the strength of your foot or leg reduced? Do you have any history of injury to the hip or back areas? Have you experienced any other symptoms? During your physical assessment, it may be appropriate and beneficial for your practitioner to complete a series of tests, including orthopedic tests, reflex tests, postural assessment, nerve stretch tests, and muscular strength tests. Occasionally, further testing may be required. This may include X-ray imaging. This can show if there's any disruption to the normal alignment of the bones in the spine. It also shows fractures in the bones. This may be requested if there's a chance of spondylolisthesis, bony fractures, or osteoarthritis in the spine. Magnetic resonance imaging, or MRI, is a type of imaging and is best at showing up any abnormalities within the soft tissues of the body. For example, the muscles, ligaments, intervertebral discs, nerves, and the spinal cord. This type of test may be requested if the lumbar disc herniation is suspected. Electromyography, or EMG, is a test which assesses the electrical activity in a muscle. It can detect whether or not weakness in a muscle is a result of reduced or poor nerve conduction. This would suggest that there's a problem with the nerves. This type of test may be requested if someone's experiencing weakness into their legs. Bone scan, also known as DEXA scan, is a type of test that can detect and monitor bone density. This type of test would be requested if osteoporosis was suspected. And lastly, blood tests. This type of test is not routinely used to diagnose low back pain. However, it might be requested to look for any signs of increased inflammation, infection, or autoimmune diseases. Non-invasive options include visiting a physical therapist, such as an osteopath or MSK physiotherapist, which can help relieve your pain and discomfort, which may occur as a result of the low back pain. Our practitioner may utilise a variety of techniques with the aim to release and stretch your tight muscles to allow for improved function and movement, help circulation and blood flow and the body's natural healing response, strengthen the deep spinal stabilising muscles through a comprehensive exercise to lower back pain program. As a result, pain will be relieved through the release of hormones known as endorphins. Your osteopath or MSK physiotherapist will additionally provide you with advice in respect to pain management techniques. These pain management techniques may include the use of hot and cold therapy. Your practitioner will also discuss an appropriate plan for your return to activity. In order to combat your low back pain, specific exercises may also be prescribed to you by your osteopath or physiotherapist. These exercises will be prescribed with the goal of improving your strength and mobility of your lower back and core muscles. Improvements in posture can also be accomplished through specific exercises. The exercise program will be bespoke to you and to your underlying cause of low back pain. This exercise plan will be controlled and progressive. In order to prevent a return of low back pain, it is important to adhere to this exercise plan. Medication for low back pain. Depending on the severity of your pain, you may decide to visit your GP. In order to relieve your symptoms, they may prescribe you with some oral medications. These can include anti-inflammatory medications, as they are prescribed to help with pain and inflammation experienced as a result of low back pain, over-the-counter painkillers, as they can help with the pain, prescription muscle relaxant medication to help with muscle spasms, and anticonvulsants or antidepressants can also help manage nerve pain. Epidural steroid injections, or ESI. This technique involves an injection of corticosteroid and a local anaesthetic into the space around your spinal cord. This technique reduces the inflammatory response within the tissues of the low back. The aim of the ESI is to provide temporary relief from your low back pain. Surgical options. Surgery may be considered for individuals who have not responded to other non-invasive forms of treatment. If necessary, organise a discussion with your spinal surgeon who can provide you with information regarding the range of surgical options that exist. The type of surgery selected would depend on a few different factors, such as the cause of the low back pain, age of the patient, mental health of the patient, and ability to function in everyday life. Below are a few different types of spinal surgery, the first of which is a discectomy. This is a type of surgery which involves the removal of damaged intervertebral discs that are compressing a nerve. The second is a laminectomy. This is a surgery which involves the removal of the back part of one or more of the vertebrae in the lumbar spine, known as the lamina. This will allow more space for the spinal nerves. As a result, the likelihood of the nerve being compressed is reduced. Spinal fusion. This is a surgery in which involves the joining of the affected bone in the spine to the bone below. This is done in order to strengthen and stabilise the spine. The last is a balloon kyphoplasty. This is a surgery that is commonly used for vertebral compression fractures. It is a minimally invasive technique where a small incision is made and tiny balloons are inflated within the fractured vertebrae. The inflated balloon restores vertebral height, and the cavity is then filled with the bone cement to maintain the vertebral height. Prevention of low back pain. Unfortunately, not all types of low back pain can be prevented. However, there are a few ways to reduce your risk and protect low back pain and further injury. The first is exercise. In order to improve stability to your spine, strength in your spinal and abdominal muscles is required. This can be attained through exercises such as yoga and Pilates. The second is lifting techniques. Poor lifting techniques can significantly increase the risk of injuring your back. To minimise risk when lifting, you should ensure that you bend from your hips and knees as opposed to your back. Squat down to the object you're picking up instead of bending down. Be sure to engage your abdominal muscles when straightening your legs to lift the object up. This can be done by keeping the object close to your body. When you're lifting an object, avoid any twisting or turning motions, and never lift objects that are too heavy above your head. Posture. Ensure that you have good posture when standing and sitting. Poor posture can lead to increased pressure of the joints, ligaments and muscles of the back. Maintain a healthy weight. Increased pressure on the spine can occur due to excess abdominal weight. This may increase the likelihood of spondylolisthesis or degenerative changes. Lastly, supportive mattress. Having a mattress that supports your spinal alignment is important. Too squishy and it may have no support. Too firm and it may create too much support. Testing your mattress can be very helpful. Most companies now allow you to test your mattress for 100 days. This is really helpful as it gives you a better understanding about the mattress that is going to be suitable and supportive for your low back pain. There is no one size fits all when it comes down to pillow and mattress advice. When to visit a GP or the hospital. The NHS website suggests that if you're experiencing any of the following symptoms, you should pay them a visit. Neurological symptoms in both of your legs, weakness or numbness in both legs that is severe or getting worse, numbness around or under your genitals or around your anus, difficulty when noticing that you need to poo or cannot control when you poo, this is not normal for you, difficulty when peeing or cannot pee or cannot control your pee, as this is also not normal for you. It is worthwhile going, or calling 101, or visiting a local GP to seek further medical advice on how to treat your symptoms, as these could be symptoms of a more serious back problem.